we are going to discuss about another childhood mental disorder, that is ADHD, Attention Deficit and Hyperactivity Disorder. In the last video, we had a discussion regarding other childhood disorder, that is anxiety disorders in childhood, and I will add the link of the video in the description box. Please watch it before going to the next video. So we will go to the video. So what is ADHD, or Attention Deficit and Hyperactivity Disorder? ADHD is a mental health disorder or childhood mental health disorder characterized by above normal level of hyperactive and impulsive behavior. Above normal level of hyperactivity is a part of everyone's life, but above normal levels of hyperactive and impulsive behavior a child is showing means that is known as ADHD, or Attention Deficit and Hyperactivity Disorder. ADHD people will show trouble in focusing their attention. They can't focus in anything, and it is a common mental health disorder in childhood. While coming to the incidence, boys have more chance to comparing to girls. So boys will show the symptoms more comparing to girls, and it can't be prevented or cured. That is another point which we need to understand. It can't be prevented or cured, but early diagnosis, specifically I'm saying early diagnosis and support, can help the child to manage the symptoms of ADHD. So that point you have to keep it in your mind. It can't be prevented or cured, but early diagnostic tools, early diagnosis and the supports can help the child to overcome the situation and help the child to perform the daily day-to-day activities. While coming to the symptoms can be classified into three. They are inattentive, hyperactivity, and impulsive behavior. So we will see each one separately. First one is inattentive. Inattentive means they can't show or give attention to anything. They are distracted in nature, doesn't follow any directions, cannot finish any task on time, cannot listen the directions properly. It doesn't mean that they have hearing problem. They can't direct or they can't follow the informations. That's it. No attention, careless mistakes, forget daily activities, like simple daily activities while going to school, example like homeworks, everything they will forget. No organization, daily task, and daydream. So these are all the things we can see in inattentive aspect of ADHD. Second thing is hyperactive. Under that we can see a lot of things like jumping, hitting, dashing, can't sit in a place for some time, trouble in playing, running, climbing on things, talkative or excessively talking, has trouble in waiting for something, they hate cues, blurts out answers and interrupts others. So these are all the things we can see in hyperactive aspects of ADHD. They do jump, hit, dash every time. If they're trying to talk something, they can't stand in a position and talk, they can't stand in a place to talk. They'll jump and talk, they will hit and talk, they will dash and talk, they will run, climb and talk. At the same time, they will interrupt others' activities. When someone is talking, they will come in the middle and they will interrupt their conversation, they will try to mimic others, etc., etc. Next thing is impulsive. Impulsive means impulsive in nature, like too quick action before thinking. Before thinking, they will start to act. Before asking, they will start to do the things. Without asking permission, they will do the things, and they have to wait and do risky things or dangerous things always in life. So these are all the impulsive aspects of ADHD. So the symptoms can be classified into two or three: inattentive, hyperactive and impulsive, or hyperactive and impulsive. If ADHD in adults, the symptoms include, that is a takeaway. If ADHD in adults, the symptoms include anxiety, forgetfulness, restlessness, low self-esteem, problems at work, no controlling anger, impulsiveness, substance abuse, frustrated in nature, bored, trouble in concentrating when reading, mood swings, relationship problems, depression. So in every aspect of their life, they will show the problems if ADHD in adulthood means. Then, what is the difference between ADHD and ADD or ADHD versus ADD? ADD means nothing, attention deficit disorder. Actually, ADD or attention deficit disorder is the old name of ADHD, old name of attention deficit and hyperactivity disorder, and it was officially changed in 1990s. But the condition is same, and some people will still use the same name only. Like instead of ADHD, some people still uses the name ADD. But both things are same. ADD and ADHD are same. Attention deficit disorder or ADHD, attention deficit and hyperactivity disorder, are same. While coming to the etiological factor, exact cause of this condition is unknown. We don't know what is the exact cause, but we know some risk factors are there behind every condition, and these factors include genes, genetic factors from the family. It will run through the family. Then imbalance in brain chemicals, some chemicals which is necessary for the normal action of the brain, and any imbalance in that brain chemicals means there are chances of ADHD. There are chances. Then problems in the brain or changes in the area where the controls will take place. Problems in the area of brain where all the controls will take place might be a reason behind ADHD. Then injury to baby during the pregnancy and childbirth. So pregnancy problem, complicated pregnancy during the time of delivery. Some injury is happening to the brain of baby means there are chances of ADHD. Then inhalation of toxin, like inhalation of toxic substances can create imbalance in brain chemical, can create problems in your brain, and that may be a reason behind ADHD. There are chances only. I'll not say this is the actual reason behind ADHD because we don't know what is the actual reason, and brain injury is also considering as a risk factor for this ADHD. There are some myths about the causes of ADHD. Some people will tell consumption of too much sugar or sugar lead to ADHD. No, not at all. Excessive consumption of sugar will not lead to ADHD. Excessive watching TV, cartoons, programs, no. That's not good, but still that is not a reason behind ADHD. And family problems, divorce are the reasons behind ADHD. No, family problems will not cause ADHD. Well, coming to the diagnostic procedures, an exact or actual diagnostic procedure is not there for ADHD, but combination of different diagnostic tools we can see, like neurological examination, psychological status checking, history collection, physical examination, mental status examination. On all these tests will done by a mental health professional and pediatrician together. They will do the test together. While coming to the management, mainly medication, therapy, parent counseling. Medication, we have to be very careful about the medication because we are dealing with children. For example, like dopamine, we will give to the child to control or slow down the brain activities, but we have to be very careful about the medications and side effects. Therapy. While coming to the therapy, behavioral therapy or talk therapy is the major therapy, and it is playing a major role in the treatment of this problem. And this therapy will help to change the maladaptive behavior into adaptive behavior. There are a lot of techniques are there in behavioral therapy. Therapists will implement the therapy techniques and will talk to the child, but it takes a lot of time to change the maladaptive behavior into lot of adaptive behavior, so we need patience. Then parent counseling and coaching also very important. Parents can do a lot because parents are the major part of the treatment. Parents are there with the child all time in the case of ADHD. So parents coaching, parents should know about the condition. Parents can talk about the condition. Parents can help the child to learn about the condition. Then support from the school. School also very important. The teacher should know about the condition, or the staff of the school should know about the condition of the child. Then only they can support the child. Then parents and ADHD children, that point is very important. Learn what is ADHD and help the child to learn what is ADHD. Parent must learn what is ADHD, what is inattentive, what is impulsive behavior, what is hyperactivity. Okay, so the parent should learn about the condition. For that, they need to go for the training, counseling, etc., and help the child to learn what is ADHD. We should make the child to learn whenever they are in a normal level, to listen. Whenever they are calm, just inform, just make them to learn. This is your condition. You need to be more cautious. You should pay some more attention to study, like that. Then involve in every treatment procedure. Be careful about the medicines. Again, I'm telling medications. We are dealing with the children, so we be very careful about the medicine of ADHD. Then work with school, provide psychological support, maintain a calm and warm environment for the child, show love and affection, plan schedule and make the child to follow, because they have problems in following the daily day-to-day activities. So plan the activities and plan the schedules and make the child to follow. So this is about attention deficit and hyperactivity disorder. Again, I'm telling, it can't be cured, it can't be prevented, but early diagnostic tools and early diagnosis will help this. He'll help or support the child to change the maladaptive behavior into adaptive behavior. Hope you understand, guys. Thank you.